How has targeted therapy improved HCC survival? Imagine a treatment that specifically targets the roots of liver cancer, helping patients live longer and better. That's what targeted therapy has brought to the fight against hepatocellular carcinoma, or HCC. These therapies focus on blocking the molecular pathways that tumors rely on to grow and spread. Unlike traditional treatments that often affect the whole body indiscriminately, targeted therapies aim at cancer cells more precisely, reducing side effects and improving outcomes. One of the biggest advances has been in prolonging survival. Clinical studies have shown that drugs like sorafenib and lenvatinib, which are tyrosine kinase inhibitors, can extend the time patients live without their disease worsening. For example, patients with advanced HCC who received these drugs often lived several months longer than those who did not. When targeted therapies are combined with immunotherapy, which helps the immune system recognize and attack cancer, the results are even better. Some studies report that patients on combination treatments can live about for more months on average compared to those on targeted therapy alone. Targeted therapy also improves how well tumors respond. More patients experience tumor shrinkage or stabilization of their disease. For instance, combining targeted drugs with immune checkpoint inhibitors has increased the percentage of patients seeing significant tumor reduction. This means the cancer is better controlled, which can lead to longer survival and a better quality of life. To make treatment more personalized, researchers have developed models that predict how individual patients will respond. These models consider factors like tumor markers and the extent of disease spread, helping doctors choose the best therapy for each person. This tailored approach can improve outcomes and avoid unnecessary side effects. Another exciting development is the combination of targeted therapy with immunotherapy. Immune checkpoint inhibitors, which block proteins like PD-1 or PD-L1, can produce durable responses in some patients. When used together with targeted drugs, they work synergistically to attack the cancer from different angles, often leading to longer-lasting control of the disease. In addition, targeted therapies are being integrated with locoregional treatments like radioembolization, where radiation is delivered directly to the tumor through the blood vessels. This combined approach can improve local tumor control, reduce recurrence after surgery or transplantation, and ultimately extend survival. Finally, because liver cancer involves multiple signaling pathways that promote tumor growth and spread, targeting several of these pathways at once can be more effective. Researchers are exploring drugs that inhibit additional mechanisms involved in cancer progression, which could lead to even better survival outcomes in the future. Overall, targeted therapy has transformed the landscape of liver cancer treatment. It offers hope for longer survival, better tumor control, and more personalized care. However, it's important to remember that each patient is unique, and treatment decisions should always be made in consultation with healthcare professionals who can tailor approaches based on individual health status and disease characteristics. Continued research and clinical trials are vital to further improve these therapies and help more patients live longer, healthier lives.